Hi and welcome to a new episode of your weekly medical TV show on الكرمة TV, White Coat. Today's episode will touch everybody in one way or another. Why? Because we'll talk about the upset stomach and what's known scientifically as dyspepsia. Also, we'll talk about the acid reflux, which medically named GERD or gastroesophageal reflux disease. An upset stomach can turn a normal day into a rough one. And you keep wondering what causes that. Is it serious or just simple case? Whether it's just indigestion, heartburn, nausea, or something else. Today we'll talk about when we should ask for help and how we change our lifestyle if we have any of those problems. We'll talk about what are the warning signs or if more investigations need to be done. And it's my pleasure and honor today to welcome back in White Coat one of the outstanding physicians in Southern California, Dr. Isaac Kim. He would teach us more about those problems and the medical management and other options to deal with those issues. As you know by now, for interaction with the program, send in all your questions and concerns to our official Facebook page, White Coat Alkarma TV, or to interact with my guest directly today. If you have any question about that topic, you can call the numbers that will be shown on the screen at any time during the episode. أعزائي مشاهدي قنوات الكرمة في كل مكان في العالم، أعزائي مشاهدي وايت كوت، أهلا بيكم في حلقة جديدة من برنامجكم الطبي على شاشات قنوات الكرمة. النهاردة حلقة تقريبا هتمس كل حد تقريبا اتعرض للنوع ده من المشاكل، وهو مشاكل عسر الهضم بشكل عام. الحقيقة الجهاز الهضمي أنا بسميه واحد من الأجهزة السيادية في جسمنا، لأنه يعني كتير من الناس عندها مشاكل مع ده نتيجة يا إما اللايف ستايل اللي الناس بتتبعه أو طريقة أكلنا أو مواعيد أكلنا بشكل عام. فsomehow المشكلة دي بتلمس كل حد فينا أو أي حد فينا تعرض ليها بشكل أو بآخر أثناء فترة حياته. زي ما أنا قلت، الموضوع النهاردة مش بس هنتكلم على فكرة مشاكل الجهاز الهضمي، إنما هتبقى بداية لسلسلة حلقات هنتكلم فيها عن مشاكل الجهاز الهضمي بشكل عام. النهاردة هناخد أول نوع من المشاكل دي اللي هي مشاكل عسر الهضم بشكل عام، أو زي ما بنسميه الحموضة أو ارتجاع الحمض للمريء كجزء من أجزاء الجهاز الهضمي. هنتكلم على أسباب المشكلة دي، هنتكلم على طرق علاجها، هنتكلم امتى يعني ناخد يبقى فيه زي ما بنسميها warning signs او علامات تحذيريه اللي هي لازم فيها ناخد مشوره طبيه. احيانا ممكن نحتاج investigations اكبر او تتعمل يعني بشكل اكبر عشان نحدد اسباب المشكله، لانه بشكل عام عسر الهضم او ارتجاع المريء ممكن قد ما هو ممكن يبقى يعني مرض زي ما بنسميه، ولكن يبقى واحد من الأعراض لمشكلة تانية أكبر بكتير. فلازم نتفهم ده ولازم نعمل الفحوصات الطبية اللازمة لده. كمان هنتكلم على إيه أسباب ارتجاع المريء. هنتكلم زي ما أنا قلت على العلاج الطبي اللي هي الأدوية المتداولة في السوق. مش بس كده، هنتكلم كمان لأنه كتير من الناس الحقيقة بعتوا لنا أول ما حطينا الآد على الفيسبوك، كتير من الناس بعتوا لنا أسئلة إن أنا باخد الميديكيشنز دي أو باخد الأدوية دي لفترة طويلة ومفيش نتيجة. فهنتكلم ايه الانفستيجيشنز اللي ممكن تتعمل بعد مرحلة الأدوية لما ما تجيبش نتيجة. امتى نوصل لمرحلة بنقول انه الأدوية مش قادرة تسيطر على المرض ده، وهل في حل جراحي. هنناقش النهاردة الحل الجراحي اللي ممكن يحصل. هنناقش كمان الكومبليكيشنز او التبعات الصحية اللي بتحصل نتيجة الحموضة المزمنة او ارتجاع المريء المزمن. كل ده هنناقشه في حلقتنا النهارده مع واحد من افضل الاطباء اللي بتتكلم في الموضوع ده في جنوب كاليفورنيا، دكتور ايزاك كيم. هيبقى ضيفنا النهارده زي ما حضراتكم عارفين، عشان تبعتوا لنا كل اسئلتكم واستفساراتكم على الفيسبوك. الصفحه الرئيسيه بتاعتنا على الفيسبوك وايت كوت الكرمة تي في زي ما ظاهره قدامكم على الشاشه دلوقتي. تقدروا تبعتوا لنا كل اسئلتكم. لو حضراتكم عايزين تتواصلوا مع ضيفي النهارده بشكل دايركت، تقدروا تتصلوا بالرقم اللي هيبقى موجود على الشاشة من جميع أنحاء العالم. تتواصلوا مع الضيف بتاعنا لو ليكوا أي أسئلة على الأدوية، على طرق العلاج، لو في حاجات مش جايبة نتيجة وحضراتكم عايزين تغيروها. كل ده هيبقى النهاردة موجود في حلقتنا النهاردة. ان شاء الله ربنا يدينا حلقه مميزه نقدر نساعد بيها حضراتكم او نغير المفاهيم العامه عن الحموضه. كمان نساعد حضراتكم ان احنا نغير اللايف ستايل او طريقه الاكل اللي بنتبعها عشان نتخلص من المشكله دي. يلا بينا على طول نروح النهارده لفقرتنا الرئيسيه عن الحموضه وارتجاع الارتجاع المريء وطرق علاجهم، ونبتدي حلقتنا النهارده من وايت كوت.
Are you tired of being overweight? Do you suffer from diabetes? Do you suffer from hypertension? Do you suffer from obstructive sleep apnea? Do you suffer from hypercholesterolemia? Have you suffered from heart attacks in the past? Strokes in the past? Are you tired of being ostracized in public? Well, I have a solution for you. Robotic bariatric surgery. This can completely change your life. I'm Dr. Bobby Baskerau. I'm a robotic bariatric surgeon. I do robotic weight loss surgery, which can completely change your life. I offer 3 different types of surgeries that can completely change your life. The sleeve gastrectomy, the lap band, and the Roux-en-Y gastric bypass. One thing that's very unique about our program is that we have a dietitian, and you will get counseled on what to eat, what not to eat, and how to optimize the utilization of your tool for good weight loss.
Hello, my name is Isaac Kim. I am originally from South Korea. I grew up with my family since I was 8 in the United States. I went to school here, and I ended up in Texas Tech University School of Medicine. I became interested in family medicine even as a first-year medical student. I loved the practicality, the immediate application of medicine to common needs and common concerns that every family has. I took on a scholarship to help pay for medical school through the United States Army, and I did an internship with the United States Army, and then graduated my residency training in Pennsylvania. I was very interested in teaching medical students when I was a resident, and I took on a career as what we call a faculty physician. That means I have my own patients, I take care of my own. I'm a family doctor for people, but I also spend half or maybe more than half my time supervising, we call it precepting, young physicians, resident physicians, teaching some medical students, and trying to teach good medicine. I say good medicine is worth talking about. My mission in medicine is to get the best that we know about health, about medical condition, and give it to everybody that needs it. The beauty of studying medicine in the Western tradition is I'm always amazed how much we do know. And we need to take it and help everyone benefit from it, to be healthier from it. My vision for my patients is, I think that most people, good or even excellent prevention is within their reach. And I would like to play some role in then getting good prevention, preventive measures, and preventive lifestyles. As the old saying goes, an ounce of prevention is worth a pound of cure. My personal hobbies, I have 3 children. They're teenagers. I spend a lot of time with my wife and mostly hang out with my children. I attend a church, so I'm pretty committed to my church. I have a dog. I love my dog. And every chance I get, I try to do a little exercise. Right now, I'm trying to bicycle and maybe balance it with walking my dog. But probably my favorite sport of all time is tennis. At least keep up with that. I give credit to Jesus Christ. I think without the gospel that changed my life, it gave me hope. It gave me meaning, purpose, and an explanation for understanding this world, understanding myself, understanding other people, understanding history, and also understanding where things are going, what the future holds. It's completely changed my life. And so I thank Jesus Christ and him above all. I thank my parents. I think part of the reason I'm in medicine is my dad. A lot of his nature of just wanting to study. He was a pastor all his life, but his love for teaching and knowledge, that is so similar to medicine. And he had a desire to figure out how to make people better. I'm very grateful every year for my wife and my children. They are a tremendous life-changing and support for me. Without them, I'm not sure what my life would be. It would be a very different life I have. So every day they are my support. They are my home. Stay tuned for me on Alkarma TV's White Coat.
اهلا بحضراتكم في الجزء الرئيسي النهارده من حلقتنا في وايت كوت، زي ما انا سميتها عن اسباب عسر الهضم. هنبتدي زي ما انا قلت هتبقى بدايه لسلسله حلقات لمشاكل الجهاز الهضمي بشكل عام. يمكن هنعمل حلقه كل شهر عن مشاكل الجهاز الهضمي. النهارده بنبتديها زي ما انا قلت بعسر الهضم، او بنسميها ارتجاع المريء، او مشاكل الحموضه بشكل عام. فان شاء الله تبقى حلقه كويسه. زي ما حضراتكم عارفين احنا بدات تجيلنا اسئلتكم على الفيسبوك، على صفحتنا الرئيسيه على الفيسبوك. كمان لو حضراتكم عايزين تتواصلوا مع ضيفي النهارده تقدروا تتصلوا بالرقم الموجود على الشاشه اي وقت من اوقات البرنامج. It would be my pleasure to welcome back in White Coat Dr. Isaac Kim. Welcome back in White Coat.
Thank you, Tamer. Good to be with you.
Dr. Kim, the GI system, like I mentioned in my intro, it's one of the most important systems in our body. And today we'll discuss one of the most common problems, which is dyspepsia or upset stomach. So to understand more about the problem, let's start with what is upset stomach, what's dyspepsia?
That's right. So dyspepsia is the more medical word that we use for what people would commonly say upset stomach or acid indigestion. That's another common word here in English. Mm-hmm. And it is very common. I think you have your slide there. Yes. People describe a discomfort, usually in the upper part of the abdomen. Okay. Very often it's related to meals. So meals seems to make it worse. A meal seems to bring it on. And they tend to have a more of an excessive fullness. Okay. There's a normal fullness with the meals. We all might overeat, but they just get full right away, or they sometimes could describe kind of a early fullness where they would normally want to eat more, but they can't because of the discomfort. And some people use the word bloating. Mm-hmm. They feel kind of something is stretched, bloated. Sometimes we hear that they burp more. They keep burping more. They eat a meal, it's uncomfortable, they keep burping. And then less commonly, there can be more serious symptoms, okay, like nausea, maybe once in a while vomiting, the appetite goes down, and of course, more seriously, if they start to lose weight because of this.
Okay. سؤالي لدكتور كيم او سؤالي الاول لدكتور كيم النهارده كان عن ايه هي الاعراض اللي بنبتدي بيها نحس مبدئيا انه في مشاكل في الجهاز الهضمي او في مشاكل في الهضم بشكل عام او في مشاكل في المعده. فقال لي عاده الناس بتبتدي تحس انه معدتها زي ما بنقول بالالفاظ الدارجه كده، وهنستخدم كتير من ده النهارده، انه معدته مش مريحاه بشكل عام. كمان حاجه مهمه جدا انه دايما بيبتدي يحس بنوع من الالام في الجزء اللي هو فوق من المعده، اللي بنسميه برضو باللفظ الدارج انه بيقول فم المعده بتاعه حاسس انه دايما مش مرتاح، دايما الم ما بين الضلوع، احيانا بيجي الم ما بين الضلوع. فده كله بيبقى مهم جدا. كمان انسان كل ما ياكل يحس انه منتفخ، ده مش طبيعي. من الحاجات المهمه اللي بتقول انه ممكن يبقى في مشاكل اكبر من ده، انه ناس دايما حاسه انه عندها غممان نفس، ميل للقيء بشكل عام. كمان الناس اللي بتفقد شهيتها تماما او بتبتدي بيحصل لها نوع من فقدان الوزن السريع جدا دون اسباب واضحه، ودي بتبقى واحده من العلامات اللي بتقلقنا جدا بشكل عام في موضوع الجهاز الهضمي، انه الواحد يبتدي يفقد كتير جدا من وزنه بدون اسباب واضحه. فدي علامه من العلامات التحذيريه اللي هو لازم في الوقت ده فعلا نسال لمشوره طبيه. So after those symptoms could be very simple symptoms, or could be very simple problem, or could be a serious problem. So when should we ask for help?
That's right. So one of the key messages that the public needs to hear is that if this kind of an abdominal discomfort leads to vomiting, especially recurrent vomiting, if they vomit blood, if they have evidence of blood that in their bowel movement or their stool, sometimes it would be digested blood, which is a very, very black tar-colored blood. I mean, tar-colored bowel movement. Or if they have food that feel like it is getting stuck, like it won't go down.
The swallowing process is not as easy as or smooth.
Yeah, if they feel it's a really clear-cut swallowing problem, or maybe it's constantly painful for the food to go down. These are some of the more serious, we call alarm features, that should make them seek a medical attention.
So if we got any of those warning symptoms, we should ask for medical help.
That is the recommendation. Okay. There's some other things, but as long as these are clear-cut, events that are happening,
we should
seek care.
Okay. الحقيقة برضو سؤالي التاني لدكتور كيم النهاردة كان بيتكلم امتى يعني بدل ما اقعد محير نفسي اذا حصلت ايه الاحداث اللي ممكن تحصل او العلامات اللي ممكن تحصل اللي بعدها لازم اسأل مشورة طبية او لازم اشوف الطبيب. فقال لي في حاجات بتبقى بالنسبة لنا مقلقة جدا، اهمهم على الاطلاق انه بيبتدي يحصل ترجيع بشكل عام، ترجيع مستمر ما بيتوقفش، وده ممكن يسبب جفاف شديد جدا للمريض. فالترجيع المستمر ده لازم على طول نسأل طبيب. حاجة تانية إذا الترجيع ده في أي نوع من أنواع الدم، يقول أنا بدأت مثلا أرجع دم، ده لازم برضو يستشير طبيب على طول. كمان حاجة مهمة جدا زي ما أنا قلت، إذا حصل فقدان للوزن بصورة كبيرة من غير سبب واضح برضو لازم نسأل الطبيب. حاجة مهمة جدا كمان قالها دكتور كيم، انه اي علامة من علامات انه في دم في الجهاز الهضمي بشكل عام، وقال اهمهم على الاطلاق ان انا ارجع دم بشكل واضح. كمان اذا لون البراز بقى لون غامق جدا اللي هو بنسميه التار ستول، او بقى لونه اسود غامق جدا، دي برضو علامة مهمة جدا انه بدأ يحصل نزيف في الجهاز الهضمي في حتة ما من الجهاز الهضمي، ده برضو لازم اسأل الطبيب. كمان إذا حصل أي نوع إنه البلع، عملية البلع نفسها ما بقتش بالسهولة الواضحة، إذا حصل إن أنا ناس كتير قوي بتقول أنا بحس بالأكل جزء نازل وهو نازل، ده مش مفروض يحصل. أو إذا في أي نوع من أنواع الألم مع البلع، كل ده مهم جدا وبتبقى علامات تحذيرية مهمة جدا إن أنا لازم أشوف الطبيب المختص بتاعي، لأنه ده مهم جدا إن إحنا نتعامل معاه على طول. Dr. Kim, what's the main reasons for dyspepsia? We said dyspepsia or upset stomach, it's like a general term. So what could be the reasons for dyspepsia?
That's right. So dyspepsia is not well understood.
Okay.
So it's very important for people to know that
it's a general term.
It's a general term for all those symptoms, primarily focused on the stomach or the upper abdomen, very often, usually related to a meal. And most people, otherwise healthy, if they get testing, blood testing, even imaging, or even the endoscopy, they don't find any significant problems.
Okay.
And most people know somebody with these symptoms. And so listed there are some of the more common underlying causes that have been proposed, but it's important to keep in mind most people, majority, they really don't find an underlying cause. So those listed problems there, a motor or nerve problem as in movement problem of the stomach, peristalsis, like a automatic movement. There's the nerve problem, like a pain sensitivity. So the pain is just extra sensitive when the usual things that sort of irritate or upset our stomach, some people are very sensitive. That causes them pain rather than just a little discomfort.
Okay.
The H. pylori, Helicobacter pylori, is a very, very big issue. This is very important to emphasize to the public that many, many people have this bacteria in their stomach lining, and it appears to not have a health consequence. So we have some patients and families asking for this testing, and they really don't have any symptoms. That should not be done.
Okay.
Because in many countries, upwards of 90% of the adult population have this bacteria in their stomach lining, and we do not recommend some type of a broad screening for this. But if the patient has dyspepsia symptoms that are troublesome,
we can screen them for it.
And it's worth considering. So
Okay.
if they have an active infection, then they ought to consider a regimen, usually three drugs that the physician prescribes for 2 weeks, and you can get rid of it from the stomach lining. The test should not be a blood test.
Okay.
It should not be a blood test, a serology antibody. It should be a stool antigen, or it should be a breath test. And then the third way you can be sure that you carry the bacteria in your stomach lining is through endoscopy.
Okay.
They take a biopsy.
Like you see actual specimen with the...
You just take a tissue biopsy and they do a standardized test. Those are the reliable tests.
Okay.
So it can be an important issue for some with symptoms that are not improving, getting better, etc.
Okay.
And then it is important to recognize that for many, depression, anxiety, this seems to play a very important role, so it should be addressed. Just one way to think of it is if you're depressed or if you're anxious,
stressed,
it hurts more. And it hurts some, but it hurts a lot more.
What we call it psychosomatic. It could
Something
be like...
a little psycho. So it's important we don't tell them that it's in your head or something like that, but something about them makes them a lot more vulnerable to these things. And they understand that, so they can pursue good counseling, good support, or a way to resolve their stresses in life. And then we will cover a little bit about diet and lifestyle, but there's limited evidence, but for some, that can make an important difference.
Because that could be like a big part of the problem, the lifestyle we live and the diet we follow and all that stuff.
That's right. We don't say, you have to lose weight. It's not clearly correlated in terms of the dyspepsia symptoms, but they were eating in a very, very erratic fashion, not careful, things like alcohol, caffeine, they're not careful watching which foods are worsening, and then they need to be avoiding those foods. So clearly diet and lifestyle changes contribute.
الحقيقة سؤالي برضو لدكتور كيم كان عن ايه هي اسباب المشاكل اللي بتحصل في الجهاز الهضمي، مشاكل عسر الهضم بشكل عام. قال احيانا انه بتبقى الوظيفة نفسها بتاع اعضاء الجهاز الهضمي زي الحركة بتاعت الأعضاء، سواء البلعوم، المريء، المعدة، الحركة نفسها فيها مشكلة، ودي ليها طرق ازاي نكتشفها. كمان ممكن جزء كبير جدا من المشكلة بيبقى نتيجة وجود بكتيريا بنسميها الاتش بايلوري، ودي بكتيريا مهمة جدا بتعمل مشاكل كتير تعمل symptoms كتيرة جدا عند البيشنتس من غير ما هم يبقوا فاهمين. فقال انه دي كمان بنعمل لها كل حاجة من دي هنناقشها بالتفصيل في حلقتنا النهاردة. قال كمان جزء كبير من المشكلة احيانا بيبقى نفسي نتيجة ضغوطات الحياة اللي بنبقى تحتها، الستريس، نوع من انواع القلق والاضطراب بشكل عام بيظهر في صورة اعراض جسدية. كمان حاجة مهمة جدا طريقة اكلنا، طريقة اللايف ستايل، كل ده ممكن يعمل مشاكل في الجهاز الهضمي بشكل عام، وهنناقش ده وكمان طرق تغييره وطرق علاج حاجة من الحاجات دي النهاردة. Dr. Kim, if I'm your patient and I presented to you with dyspepsia, what kind of question or how do you evaluate me as a patient? What would you ask me and the indication for each question?
That's right. So getting a good past medical history. So some people, they've already been diagnosed ulcer, they've already had an endoscopy, so getting that is very helpful. Some people, they take the aspirin family of medicines. There's very good pain relief from
So it's very important to go over my medication history.
That's right. So the medication history is very important. The aspirin family is a known cause of stomach ulcers, and it's possible for some people they may have sort of a lesser, milder kind of a low-grade ulcer going on, and so it's very important clue if those drugs seem to maybe lead to or trigger some of these symptoms. Mm-hmm. Of course, if there's heartburn, you want to address that. Some people, the location of the pain gives us some important clues. Obviously, in the right upper abdomen, there's the gallbladder, and the liver system tends to be in that right upper direction. But also some other clues in the pattern of the abdominal pain. We would consider imaging versus some other studies there.
Yeah, that's my, like, what's the testing, the recommendation testing for this problem?
For what?
For the dyspepsia in general.
So it's very important that the public understands that most people who don't have what we think are alarm, these worrisome features, there is probably not much testing needed. Okay. Now, many physicians in a Western society like United States might do a basic blood work. Okay. They may consider this H. pylori, especially if the symptoms are not mild. I think those are reasonable initial tests, but not all need endoscopy. I think it's important people understand that, and it's important to think about all the alarm features, all the more serious, concerning symptoms, they should get endoscopy.
الحقيقة سؤالي برضو الدكتور كيم كان عن ايه هي ازاي بتعمل ايفالويشن، ازاي بتعمل تقييم لحالة عسر الهضم او مشاكل الهضم بشكل عام. فقال لي مهم جدا انه دايما ان احنا نسأل البيشنتس عن طبيعة الألم، اذا معاه حموضة مفيش حموضة، ناخد كمان ميديكيشن هيستوري. واكد على النقطة دي جدا انه احيانا بتبقى كل مشاكل الجهاز الهضمي بتاعنا جاية من طريقة العلاج او العلاجات اللي بناخدها من يعني على الشلف زي ما بنقول، زي الاسبرين بشكل عام ممكن يعمل مشكلة كبيرة لو احنا بناخده بانتظام ومش تحت اشراف طبيب. كمان بعض مسكنات الألم ممكن تعمل مشاكل كبيرة جدا في الجهاز الهضمي. كل ده مهم ان احنا نتنبه له بشكل عام. قال في الحالات البسيطة من عسر الهضم بس بنشوف ايه هي لو في مشاكل في البكتيريا بتاع الاتش بايلوري، مهم جدا ان احنا نشوفها. بنعمل تحليلات دم بسيطة جدا. كل ده لو المشكلة بسيطة بشكل عام ومش محتاجة تدخل كبير او مفيش الساينز او العلامات اللي تقلقنا بشكل عام مع المريض. So simple dyspepsia case, what would be the treatment? How do you treat such a case?
For most people, the diet, lifestyle. So if they are eating in a very unwise fashion, excessive alcohol, excessive caffeine, probably tobacco, then they need to really moderate that or avoid those things. And then I think generally being a little bit more cautious about what you're eating. We cannot say what food is obviously bad. Maybe there's a lot of fatty, a lot of oily foods. Mm-hmm. That seems to trigger more symptoms in general. But many patients describe very, very individual experience with different foods. So a good recommendation is to have a good log, just being in the pattern of tracking your food. And most people seem to do it naturally. and they kind of know what foods tend to send them off. Just a trial and error. That is a good beginning.
Okay.
A lot of people are interested in natural herbal supplements.
Okay.
And the studies are limited. But there appear to be some herbals. I think there's a peppermint oil, peppermint containing herbals, maybe this caraway seed, some combos out there. They have some evidence of benefit. Always be cautious about low quality herbals, such as certain countries are known to produce poor quality contaminants, pesticides, etc. But reliable brand name, certain herbal natural supplements can soothe the stomach.
So before taking any supplement, consult your doctor first.
Consult, and I think in the United States we have a website through the government that you can kind of look up recommendations there. And a good brand, a good trusted brand that's very, very, they have a strong reputation. And then consider an acid-reducing medicine trial. That is also very reasonable.
Okay. What kind of acid-reducing medication that we can start with? Because most of them is, it's over-the-counter now. So
that's right.
It doesn't need prescription. So what people can start with?
That's right. So I don't know if they can see the slide there. There's a
slide 10
category called histamine blockers. This is an older, they've been around longer. I think the advantage of this medicine is they work rapidly. Okay. So it's the one after that, the histamine blockers. Their onset is very rapid. So they're really good, in my opinion, for as needed. That means you don't need everyday medicine to lower your acid.
Just to start with.
So like the Pepcid there, the Zantac brand, they're in all stores in the United States. And some people take an antacid, like a liquid antacid or a tablet antacid. That also immediately neutralizes the stomach. But these medicines, they reduce the acid production in the stomach rather quickly, usually like 1 hour or so. So they're really good for that. These histamine blockers do not work well if people say, well, I need to take it every day, because there's this tolerance, or there's a tachyphylaxis, we say. That means the body just doesn't respond to this medicine as well over time.
So if it didn't work, what category should I go to?
So if people repeatedly want benefit from a medicine to reduce acid, then that first class called PPI, proton pump inhibitor, they are much better at suppressing the acid and doing it over time. So the one disadvantage might be they start to work slower. That might require maybe a couple of days, 2-3 days before they start to notice the difference, but they keep the acid at a lower production in the body. So people who rely on regular medicine help, they are preferred.
Okay.
I hope that makes sense.
Can we mention like some of those
so omeprazole, Prilosec, very cheap, generic. It's been around the longest. It's widely available in the United States, and I would think most of Western nations. The esomeprazole, Nexium, that's also available, and the Prevacid, Lansoprazole. These are quite available in the United States,
right,
and they're quite affordable now. I would definitely get the generic brands.
And Dexlant is the highest dose, 60 milligram of those, right?
Yeah, they're still prescription only. Protonics, as far as I've seen, they're still prescription only. And then the other brand, Asifex, we rarely see them, but they're available by prescription.
Okay. الحقيقة قبل ما ندخل بقى في موضوعنا الرئيسي النهاردة أو المشكلة الرئيسية اللي هي الحموضة أو ارتجاع المريء، حبيت بس أناقش في الأول مع دكتور كيم إيه هي الأعراض عسر الهضم البسيطة زي ما ذكرناها لحضراتكم، إيه هي الأعراض اللي ممكن تخلينا نفكر في حاجة أبعد من كده أو نعمل انفستيجيشنز أكبر. كمان مهم جدا علاج عسر الهضم البسيط اللي بيحصل. فالحقيقة ليه رقم واحد في علاج القصة دي إن احنا نغير الدايت بتاعنا، نغير اللايف ستايل بتاعنا قدر الإمكان. محبي الكافيين يقللوا شوية الكافيين اللي بيستهلكوه يوميا ولو لكوباية واحدة في اليوم، لأنه ممكن على فكرة وشوفنا كتير جدا patients بيبقى الكافيين هو المشكلة. أول ما بيبطلوه الأعراض بتاعتهم بتتحسن جدا بشكل عام. كمان الكحوليات بشكل عام بتعمل مشاكل كبيرة جدا في المعدة وفي الجهاز الهضمي. قال لي كمان الناس ممكن تغير اللايف ستايل بتاعها بشكل ان هي تاكل يعني وجبات بكميات اقل، وممكن اكتر من 3 مرات في اليوم، ولكن تاكلها بشكل اقل. كمان مهم جدا نهتم بمواعيد اكلنا، ان احنا ما ناكلش متاخر قوي قبل النوم بشكل عام، لانه ده بيعمل مشكله كبيره جدا. قال لي كمان ممكن نبتدي نجرب الحاجات اللي موجوده اوفر ذا كاونتر، الحاجات اللي موجوده على الشلف في الصيدليات. واول الحاجات اللي ممكن نبتدي بيها كاتيجوري مهم جدا اسمه H2 blockers او Histamine blockers بشكل عام. وده في منه انواع كتيره زي ما حضراتكم عارفين. موجود منها على سبيل المثال الزانتاك، ده موجود على في كل الصيدليات، مش محتاج بريسكريبشن. موجود البيبسيد، دي ادويه ممكن نبتدي بيها، بتبقى موجوده على الشلف، مش محتاجه روجيت الطبيب. حضراتكم ممكن تبتدوا بيها، ولكن لو المشكله دي مش بتحصل كل يوم، لو حضرتك المشكله دي بتحصل كل يوم وعايز تنقل لنوع تاني من الادويه قد تساعدك اكتر، في كلاس تاني من الميديكيشنز بنسميه البروتون بامب انهبيتورز او البي بي ايز. ودي على سبيل الامثله الموجوده في السوق البرالوسيك، الاوميبرازول، او النيكسيوم او البريفيسيد. كل ده موجود على الشلف وممكن تبتدوا بيه. لو ده ما حلش المشكله، يبقى احنا زي ما انا قلت رقم 1 ان احنا نغير ستايل حياتنا، نغير طريقه الاكل، نقلل المواد اللي يعني ممكن تعمل المشاكل دي. اهمهم على سبيل المثال الكحوليات، الكافيين بشكل عام، القهوه، الشاي، الحاجات دي نقللها تماما، ويا ريت يستحسن لو نمنعها ونشوف الفرق. كمان النعناع وكل الحاجات دي بتعمل مشاكل احيانا مع المعده. حاجه تانية ان احنا نجرب الميديكيشن دي، لو ده ما نفعش يبقى احنا قدام مشكله لازم ان احنا نشوف ايه اسبابها، وغالبا بيبقى فيه سبب ورا الكلام ده. عشان كده احنا قلنا نناقش بس في الاول عسر الهضم البسيط او مشاكل الجهاز الهضمي اللي بتبقى بشكل بسيط. هنبتدي مع حضراتكم دلوقتي واحد من الاسباب الكبيره في مشاكل الجهاز الهضمي، اللي هو ارتجاع المريء، او زي ما احنا بنسميه انه الحمض يرجع تاني للمريء. وده بيبقى واحد من الاسباب المهمه جدا او من مشاكل الجهاز الهضمي الكبيره. هنبتديها مع حضراتكم دلوقتي، نشوف ايه اسبابها، طرق علاجها، لانه ناس كتير جدا بعتت لنا انه ارتجاع الحمض او ارتجاع المريء زي ما بنسميه بيعمل لهم مشاكل كبيره جدا، ومش عارفين يتعاملوا مع المشكله دي بشكل فعال. So one of the main reasons for dyspepsia in general is GERD or the acid reflux. So in the beginning, what is acid reflux? How it happens, the mechanism behind the acid reflux?
So acid reflux is stomach acid going up into our esophagus, and it's important to emphasize that this happens to everyone. This is a normal event. When it becomes a disease, which we call GERD, gastroesophageal reflux disease, is when it causes bothersome, problematic pain or symptoms, or injury to the esophagus, like inflammation, ulcers, etc. That usually requires endoscopy. That's the disease. So causes symptoms, pain, discomfort, or more serious disease from studies.
Okay. الحقيقة سؤالي لدكتور كام عن ايه هو ارتجاع المريء او ارتجاع الحمض تاني. قال انه الحمض ده بيبقى موجود في معدتنا، فبدل ما بيفضل بيطلع لفوق للجزء الاسفل من المريء بشكل عام، وده بيعمل مشاكل كتير جدا وبيعمل اعراض كتيرة جدا. كمان احيانا قال لي السبب الرئيسي للمشكلة انه زي ما حضراتكم عارفين انه اخر جزء من المريء بيبقى متصل بالمعده، وفي بينهم زي حلقه او بوابه زي ما بنسميها. فالمفروض انه الحلقه دي او البوابه دي تبقى دايما مقفوله عشان الحمض ما يرتجعش تاني للمريء او ما يحصلوش ارتجاع للمريء. الحقيقه انه الحلقه دي او البوابه دي بتبقى بتفقد التون بتاعها بشكل عام وبتتفتح، فده بيؤدي الى ارتجاع المريء تاني بدل ما يفضل في المعده. بيعمل مشاكل كتيره جدا جدا هنقولها لحضراتكم، وبيعمل اعراض كتيره جدا. الفكره كلها ان احنا دايما يا اما نشتغل على الاسيد نفسه، يا اما نشتغل على الحمض نفسه ونقلله، يا اما نشتغل على الجزء اللي ما بين المريء والمعده ونحاول دايما نخليه مقفول او نحافظ على التون بتاعه انه ما يتفتحش اثناء عمليه الهضم وانه الاسيد يرجع تاني. فدي بتبقى الحلول اللي قدامنا. Dr. Kim, the clinical presentation for the GERD, how does it present, like the main presentations or symptoms for GERD?
So I think you had an excellent slide there. I really like this slide. There's the typical, the common, and then there's the
Atypical.
less common or atypical.
Slide 14.
So typical is people describe a discomfort or pain from the stomach area into the middle of their chest toward their throat. Very often they feel it into the back of their throat as high, but sometimes not so high. So variations of up and down in the middle. And then the atypical, and this could be, we know people could describe chest pain. We know people could describe something in their voice box, so like a hoarseness or constant clearing of the throat.
Voice changes in general, yeah.
Then there's, some of it can actually come down the lung tree, and they could have a little bit of wheezing, asthma-like manifestation. It's described as coming all the way up to the back of our throat, very high, and it could even reach our sinuses. It's quite rare. Some people have a very persistent, non-productive, a dry cough. And then, like I mentioned, aspiration there, where you keep kind of swallowing and choking some of that, and it's
and
going...
You feel, some people feel some metallic taste.
They could have a bad taste in the back of their mouth. There's a phenomenon where it comes and it stimulates this saliva production we call water brash. It's a very unpleasant taste, and your saliva just starts secreting because the acid went back high up and it stimulated saliva to come out. And then it could even go to your teeth, your enamel, and dentists can describe where they see, especially some of the back of some of the teeth, starting to wear out from acid.
Dental caries. Right.
So it's important to just kind of keep that in mind. For most people, they stay in the typical zone to varying degrees.
Okay. الحقيقة سؤالي لدكتور كيم كان ايه هي اعراض ارتجاع المريء او الحموضة بشكل عام، ارتجاع الحمض للمريء. قال لي في اعراض بتبقى كلاسيكال جدا البيشنت بيجي بيها، بنبقى عارفين رقم واحد ان بيقول انا حاسس حرقان فظيع في معدتي او في صدري بشكل عام. كمان احيانا في ناس بتقول الجزء العلوي من الصدر ده بتحس فيه بحرقان شديد جدا، ده بعد خصوصا في الفترة بعد الاكل. فده بيبقى كلاسيك برزنتيشن زي ما بنقول بيشنت بيجي بيها. بيشنت تانيين بيجوا باعراض ممكن ما نفكرش اصلا انه ده اسيد ريفلكس، بس الحقيقه انه بيبقى السبب الرئيسي فيها هو الاسيد ريفلكس. اهمهم على الاطلاق ناس بتيجي بتغيرات في الصوت ويفضلوا يروحوا لدكاتره انف واذن وكل المشاكل دي، ولكن تغيرات الصوت دي او بحه في الصوت ده جاي نتيجه الاسيد. ويمكن حضراتكم ما تتخيلوش انه دي تبقى سيمبتومز او واحده من الاعراض اللي بيجي بيها البيشنتس. بيشنتس تانيين او مرضى تانيين بيجوا بالم في الصدر بشكل عام. ناس تانية بتيجي بالتهابات في الحنجره. يمكن حضراتكم ما تتخيلوش النقطه الجايه دي، ولكن بيشنتس بتيجي على اساس انه عندها ازمه مش قادره تتنفس طول الوقت وتقول انه هي مش قادره تاخد نفسها، ودايما كحه مزمنه. كل ده ممكن يبقى اعراض نتيجه ارتجاع الحمض. ناس تانية ممكن توصل لدرجة انه الحمض بيرتجع لحد بقها وتقول انه دايما انا حاسة بطعم غريب في بقي. وكمان ناس لدرجة انه بعض البيشنتس بتبقى المشكلة عندهم سيئة جدا لدرجة ان احنا بنشوف مشاكل في الاسنان نتيجة وجود الحمض باستمرار في منطقة الفم، وبيعمل لها مشاكل كتيرة جدا. زي ما انا قلت في احيانا بيشنت بيجي بصورة كلاسيك جدا ان انا عندي حرقان في معدتي في صدري وبحس بالحمض نفسه. دي بتبقى واضحة جدا. زي ما انا قلت لحضراتكم احيانا المرضى بتيجي باشكال او تشتكي من حاجات نتخيل انها بعيدة تماما، ولكن بيبقى سببها الرئيسي هو ارتجاع الحمض بشكل عام. So Dr. Kim, in GERD, what happens? The physiology, the pathophysiology behind it, or the mechanism behind the GERD?
So our body naturally has a sphincter-like function in the esophagus, right on top of our stomach. And even though we all have some acid that comes up, usually that sphincter works and it keeps most of the acid down inside the stomach.
Slide 15.
While allowing for food to come down and our constant saliva to be coming down. So it just has a nice, like a pressure. But for many of these people, it's not working very well. It doesn't have enough of a pressure. So a lot of the stomach's acid, which is constantly churning, especially after a meal,
goes back
up. Also, even apart from a meal, especially at night for many people, there's a surge of acid that, as the body is lying flat, seems to come up that way as well. So there's something going on there. And then there's some other factors, as this slide points out. There may be stomach factors where the stomach is not emptying like it should, so there's more wanting to back up. Hiatal hernia, this is the muscle, the diaphragm, that is on top of our liver and our stomach, and it allows us to take a breath because the muscle tightens and it pulls downward, allowing the lung to expand. Well, this thing has to have an opening for the esophagus to come through. I think the diagram kind of shows it. And when that opening is too big, then part of the stomach can push into that, and it would affect the ability of that sphincter to do its job. It's also quite common. And then the esophagus might have some irregular motility. It normally has a nice peristaltic movement to bring food and drink down. That may not work so well in some people. And then they point out the saliva. Some people, the saliva, they don't produce enough, or maybe the pH balance is off.
Okay. الحقيقة زي سألت دكتور كامل برضو ايه هي الأسباب الرئيسية اللي بتنتج من ارتجاع الحمض أو زيادة الحموضة. عايز حضراتكم تركزوا معايا في الجزء ده جدا، لأنه ده اللي هنناقش منه كل المشاكل التانية اللي بتحصل نتيجة أو بتبقى مسببة لارتجاع الحمض. الحقيقة سلايد 15 حلوة جدا وهتبين لحضراتكم ايه المشاكل اللي بتحصل في ده. لو بصينا على السلايد ويا ريت بالبوينتر تحت بالجزء الأولاني اللي هو الجزء اللي تحت الجنكشن ما بين المعدة والمريء، الجزء التحتاني، يا ريت نحط البوينتر عليه بالظبط كده. دي المفروض بوابة أو حلقة المفروض تبقى مقفولة أثناء عملية الهضم، لأنه الأسيد بيفرز أو الحمض بيفرز من المعدة عشان يشتغل على الأكل اللي موجود في المعدة. نتيجة أنه الجنكشن ده أو البوابة دي بتفقد التون بتاعها، بيبتدي الأسيد يرجع تاني للمريء وبيعمل لنا المشاكل دي. كمان جزء مهم جدا الجزء المنتفخ اللي فوق المعدة على طول بالظبط اللي عليه البوينتر ده، دي نوع من أنواع الفتاء بنسميها بيحصل، بنسميه الهايتال هيرنيا أو نوع من الهرنيا اللي بتعمل مشاكل وبتعمل الجزء المنتفخ اللي فوق المعدة ده، وبتخلي انه الحمض يتجمع في المنطقة دي حتى لو المعدة مقفولة، وبيعمل مشاكل كتير جدا. كمان حاجة مهمة جدا حركة البلعوم نفسه والمريء بالظبط. الأنبوبة الطويلة اللي حضراتكم شايفينها دي المفروض انه الحركة بتاعتها انه هي كلها بتدفع الأكل لتحت ناحية المعدة. لو الحركة دي فيها مشكلة اللي هي الموتاليتي نفسها فيها مشكلة، بدل ما الأكل بيطلع لتحت أحيانا الأكل بيحصل له ستاك، إنه بيقف في المنطقة دي والأسيد هو اللي بيطلع للأكل فوق وبتعمل مشكلة تانية. هنناقش كل ده بالتفصيل وإيه طرق العلاج بتاعته. كل دي بتبقى الأسباب الرئيسية لمشكلة ارتجاع المعدة. يا المشكلة جاية في المعدة نفسها، يا إما بتفرز حمض زيادة عن اللزوم وده اللي بيعمل المشاكل دي، يا إما البوابة اللي ما بين المريء والمعدة فيها مشكلة وبتخلي الأسيد يرجع تاني لفوق، يا إما بيحصل جزء من الفتاء في المريء اللي بنسميه الهيتال هيرنيا وهي اللي تبقى عاملة المشكلة، أو حركة البلعوم نفسها. فدي الأربع خمس مسببات الرئيسية لفكرة ارتجاع الحمض. We have a phone call from New Jersey. بنت الرب من نيو جيرسي، اتفضلي حضرتك معانا على الهواء.
ايوه، مساء الخير.
مساء النور، اتفضلي.
متشكرين على البرنامج الجميل، ربنا يبارككم. انا عندي دوالي في المريء.
اوكي.
وبعدين كل شويه عايزيني اعمل منظار، وانا عندي انيميا حاده.
اوكي.
وعندي هيباتيتس سي وارثرايتس. وبعدين
عند حضرتك هيباتيتس سي وايه تاني؟
ارثرايتس والايرون واطي خالص، نسب الدم كلها عندي واطيه خالص. فقبل كده عملت منظار في المريء، فعملوا لي فجرحوا لي المعده خالص. قعدت في المستشفى 4 أيام عشان يعالجوني من الجرح اللي عملوه.
اوكي، سؤال حضرتك
مش عارفه اعمله تاني ولا بلاش. باخد امبريزول مش نافع، وعندي نزيف، مفيش ترجيع.
اوكي، حضرتك عندك هايتال هيرنيا كمان ولا لا؟
نعم،
حضرتك عندك هيرنيا كمان، نوع من الفتاء اللي بيبقى
هيرنيا. ايوه، يس. عملت هيرنيا قبل كده وبعدين رجعت لي تاني.
اوكي،
بس مش قادر اعملها عشان هيباتيتس سي. قالوا لي خطر على الكبد.
Okay, she has hepatitis C, esophageal varices, and she has recurrent hiatal hernia as well. And she did endoscopy, and she's asking if with the varices she can do it again or not, because she has chronic hepatitis C and anemia as well.
Right, so with the varices, do what again?
The varices bleed sometimes, so she's asking if she, is it recommended to do the endoscopy one more time? Or?
Oh, I see. So she's in a very, very special and advanced disease situation. Her liver is very advanced. She has cirrhosis, hardening from her liver, from hepatitis C, sounds like. And so her varices, they also give you a grade to the severity. So the more severe the grade of the varices, the more likely they may bleed again. So they need to be checking up on it, and they need to go back in.
But she's asking, she had bleeding from the first endoscopy.
So if she has bled before because of the varices, it sure suggests that there is a strong possibility of rebleeding.
Okay.
So
she's taking omeprazole as well for you, and it doesn't control her symptoms of heartburn.
That's right. I think for this crowd, they do it just in case, but they need to take it. And the varices are likely to, there's a good chance they can bleed again. And I do think that periodically they need to go back in to see if those varices can be treated. They often do banding to make the varices that protrude to prevent them from bleeding. So if she's worried about maybe too many endoscopies, I would generally say they need to go back in to monitor, take a look how they're doing before another big bleed occurs.
And with the help of some blood transfusion can solve the issue of anemia during the endoscopy.
That's right. So when they bleed out, then they're going to need to be hospitalized, watched, and they'll go in right away to see what else they can do to stop any sources. And they usually need a transfusion. But I wouldn't hesitate to go back follow their recommendation to take another look, because endoscopy is not risky, and she's at a high risk for varices to get worse.
And it's the standard care for varices.
For varices, they need to go back in. Right. And she's already bled, so this is quite a high-risk situation. God bless you.
بنت الرب من نيوجيرسي، لو حضرتك لسه سامعانا، زي ما قال دكتور كيم، في حالات دوالي المريء تحديدا الاندوسكوبي أو المنظار لازم بيتعمل في الحالات دي، عشان لو حصل بليدنج في المرة الأولى من المحتمل إنه يفضل يحصل بليدنج، وإحنا لازم نشوف بالمنظار إيه اللي بيحصل بالظبط. فحضرتك من الأفضل إن أنت تعملي المنظار مرة تانية، مع كمان مساعدة لو نقلنا دم هيساعد شوية في موضوع الأنيميا، وهيساعد الليفلز بتاع حضرتك إنها تفضل عند ليفل معقول. بس لازم الاندوسكوبي يتعمل، فمن المفضل إن حضرتك تعملي الاندوسكوبي تاني. I have another question on Facebook here. A patient has severe heartburn, and she's taking famotidine 40 milligram and omeprazole 40 milligram to control the symptoms, but she has hiatal hernia, and she has black stool. So she's asking for recommendation. She says famotidine and omeprazole doesn't help as much.
So she's in a tough situation. The hiatal hernia does not have an automatic fix. We wouldn't say people with severe heartburn and a hiatal hernia get surgery. I think we're going to cover a little bit on surgery. Right. Surgery is for very, very, very small group of people. I think if there's a lot of regurgitation and the medications tend to work, then they should consider surgery.
And she has one of the warning signs too because she started to have black stool.
That's right. So with the black stool, just to make sure they're not taking Pepto-Bismol. That will make stool clearly black.
Okay.
And she's not on an iron supplement. That will make the stool black. But if apart from that, she's passing something that looks like clearly black, tar, jet black stool, that's very worrisome. And she needs to report that to her physician right away.
Okay. واحد من الأسئلة اللي جاية لنا بتقول إنه في patient تاخد الفاموتيدين 40 مللي جرام، بتاخد كمان اوميبرازول 40 مللي جرام، عندها ارتجاع شديد جدا في الحمض أو في المريء، بتقول كمان إنه عندها النوع ده من الفتاء في المريء، وابتدى يبقى عندها البراز بتاعها يبقى أسود جدا. زي ما قال دكتور كام إنه فكرة البراز الأسود دي لازم نستبعد حاجتين، انه حضرتك ما بتاخديش اي نوع من الحديد بكميات كبيره، ما بتاخديش كمان حاجه اسمها بيبتوبازمو. لو ما بتاخديش دول وابتدى يبقى عندك بلاك ستول لازم ناخد الموضوع بشكل سيريس اكتر، ولازم نبص ايه اسباب انه قد يكون في نزيف في حته ما في الجهاز الهضمي، لازم نكتشف ده فين. زائد انه بتقولي حضرتك ان السيمتومز كمان مش كنترول، حضرتك بتاخدي فاموتيدين 40 مللي جرام وميبرازول 40 مللي جرام والسيمتومز لسه مش كنترول، فلازم نبص بشكل سيريس اكتر في الموضوع ده. وزي ما انا قلت لو حضرتك ما بتاخديش حديد، ما بتاخديش بيبتوبازمو، لازم تاخدي الموضوع بشكل سيريس لانه هيبقى غالبا في نزيف في حته ما في الجهاز الهضمي. هناخد بريك مع حضراتكم، بنحاول ناخد تليفونات قد ما نقدر او الاسئله قد ما نقدر. هنرجع في كمان اسئله تانية هناخدها، وهناخد بريك ونرجع مع حضراتكم نكمل موضوعنا النهارده عن ارتجاع الحمض او ارتجاع المريء. ناخد بريك ونشوف حضراتكم بعد الفاصل.
Are you tired of being overweight? Do you suffer from diabetes? Do you suffer from hypertension? Do you suffer from obstructive sleep apnea? Do you suffer from hypercholesterolemia? Have you suffered from heart attacks in the past? Strokes in the past? Are you tired of being ostracized in public? Well, I have a solution for you. Robotic bariatric surgery. This can completely change your life. I'm Dr. Bobby Baskerau. I'm a robotic bariatric surgeon. I do robotic weight loss surgery, which can completely change your life. I offer 3 different types of surgeries that can completely change your life: the sleeve gastrectomy, the lap band, and the Roux-en-Y gastric bypass. One thing that's very unique about our program is that we have a dietitian, and you will get counseled on what to eat, what not to eat, and how to optimize the utilization of your tool for good weight loss.
Hi, and welcome to the first episode of White Coat. I'm Tamer, Meshel, the host of the new show, White Coat.
And people begin to drink alcohol as a social lubricant, and from there they begin to misuse it, and they abuse it.
Not focus so much on the chemical and think more of the brain. In other words, the person.
Behavioral interventions are crucial. What we have to recognize is a non-judgmental, loving, compassionate support.
The best way to treat addiction is to prevent it, okay? So be very mindful, be educated, work with a doctor that knows what they're prescribed.
I would hope through programs like yours, getting the word out, that people understand it's not that they're bad people, it's just that they're ill.
Take care of your sleep if you want to sleep. Go to bed at about the same time every day.
Most of our communities across the country are struggling in one way or another with drugs. It affects our level of productivity, it affects our kids in schools.
you don't want to take anybody for granted. I mean, Henry and I, for instance, when he does the dishes every night, which he loves to do for some reason, I always thank him.
We can have excellent diabetes control, and we can prevent most complications if we start early enough.
To discontinue any sugary drinks or only have 1 cup a day. Number 2, be aware of your calories.
Thank you for your overwhelming support and your wonderful interaction with White Coat. اهلا بحضراتكم مره تانية في الجزء الاخير من حلقتنا النهارده من وايت كوت. هاخد شويه اسئله سريعه على الفيسبوك لانه جاي لنا اسئله كتير جدا. Dr. Kim, we have some questions. The first one, she has been on omeprazole and she's asking, does it cause any kind of osteoporosis?
So this has been a long-term discussion in the medical literature. Some large population analysis suggests that chronic use, long-term use, especially the older, that there's a little bit more osteopenia. I'm not sure we're going to say osteoporosis, but there's evidence of some contribution to thinning of the bones. It might have to do with the acid. If you reduce the amount of acid in the stomach, you may alter the absorption of nutrients like calcium.
How can we help? She can be on some calcium.
So and this is one of only about 7, 8. The list sometimes seems to keep growing of potential adverse consequences of having to take chronic PPI because it's helping you. You don't want to get off these pills. So we're in this little bit of a... so the conclusion goes like this. If it clearly helps your symptoms, meaning you try going to maybe the slightly less effective class, the histamine blockers, Pepcid, Zantac, Tagamet, and they don't work as well. So you're back to this PPI class. You also gone to the lowest dose of your PPI. So there's the 40 milligram omeprazole, there's the 20 milligram. You've gone to the lowest dose, and you've gone to the lowest dose, and it's what you need for symptom control. You've tried lifestyle changes, you've tried elevating the bed angle, and you still need this help. Most experts feel that you ought to continue these medicines because if you look at the contribution to things like the bone issue, it really appears mild.
Can she add some, she's asking if she can add some calcium to it.
Oh, absolutely. So that she should perhaps maybe counteract that. Everybody should be supplementing themselves with at least 1,000 units of vitamin D3 every day. I do, and that's standard recommendation for all adults. Of course, weight bearing, like exercise, walking as much as you can. And then I think supplementing with calcium, those are good ideas. But so long as she's done what she can and she requires this dose of PPI, it's the lowest dose, and it benefits her, most people feel, most experts feel that the benefit outweighs this potential small population-based risk.
الحقيقة مدام شادية بعت لنا سؤال بتقول إنه هي بتاخد أوميبرازول عشان مشكلة ارتجاع الحمض وبتسأل إذا ده بيسبب أي نوع من هشاشة العظام زي ما دكتور كيم قال إنه الأوميبرازول على اللونج ران بيسبب نوع بسيط من أنواع هشاشة العظام. ممكن حضرتك تاخدي معاه كالسيوم ولكن الأوميبرازول على اللونج ران قوي بيسبب النوع ده من المشاكل. ممكن حضرتك الأول تبتدي بالأوميبرازول بدل ما بتاخدي 40 مللي جرام تاخدي 20 مللي جرام. إذا السيمتومز مش كنترولد قوي ممكن تروحي لل40 وممكن تاخدي معاه شوية كالسيوم عشان حضرتك تقدري تمنعي فكرة هشاشة العظام. The other question, it's an infant, 6 months, and he has severe GERD and nothing is helping.
So this is a very, very common situation with pediatrics, especially infants. That means under 1 year of age. The first 6 months of an infant, this would be the vast, vast majority of babies. They all have regurgitation.
Okay.
And this regurgitation, most of them has no serious health consequences. Now, it's troubling because they keep regurgitating, and of course, that's a little bit worrisome to the mother or the family. We definitely scrutinize in the checkups the weight curve just to make sure that they're nutritionally gaining the weight like they should. And most of these babies are gaining weight just fine, despite frequent regurgitation. Another thing, of course, we want to be sure, especially the first 1-2 months.
Actually, I want to say something. Yeah. He's 4 months, and he's already taking medication for it, and it doesn't work.
Okay. So that suggests to me that it's already under the care and
One more thing, just to make the picture clear for you. 4 months taking medication, didn't work, and she lost more than 3 pounds of her weight.
Okay, so this sounds like one of the rare and more complicated situations. In infants, if it seems to hurt, if there's distress about that, then there is a trial of one of the acid-suppressing medications. Sounds like that's already being done. And of course, if they're dropping weight or falling off the curve, they're not gaining weight like they should, those are real concerning situations. It's important to emphasize to most of the listening audience dealing with an infant with regurgitation, it's important to emphasize this is a very, very narrow scenario. I would even suggest like a 1% or less. Very unfortunate. Mm-hmm. I think in this scenario, we would immediately consult with much university, like a university-based pediatric gastroenterology subspecialty.
So she's asking surgery could be a solution in this case?
I mean, it's hard enough to think surgery in adults. In infants this young, this is a sounds like a very severe
case,
unusual situation. And if there was a surgery, it would be something like a temporary surgery because they've got to grow.
They grow out of it.
Yeah, so surgical ideas are really far off the chart in them. They might try certain things that are temporarily going to reduce all the extra acid.
I want to use this scenario. So if you can give precautions for our viewers today, how to deal with the kids if they have any kind of regurgitation. It doesn't have to be this severe, but just general precautions.
So general precaution for infants and some toddlers, we generally ask them to maybe try a little bit more upright or a reclining posture, maybe when they're sleeping or after a meal. Smaller feeds might help them to have less regurgitation, and mostly we reassure, because unless that infant is hurting and crying, they outgrow it. So usually past 6 months, the amount of regurgitation in infants just keeps going down and down and down, and by the time they're past a year, it's relatively a lesser problem, and they're very, very, reassured by the improvement.
هي مدام إزيس اللي بعت لنا سؤال بتقول إن بنتها 4 شهور بترجع على طول، اديتها نوع دواء مش جايب نتيجة، ما قالتش إيه هو نوع الدواء، وفقدت تقريبا كيلو من وزنها. الحقيقة مدام إزيس زي ما قال دكتور كيم هنفضل على البريكوشنز العادية. الأخبار الكويسة إنه يوجوالي لما بيكبروا الموضوع ده بينتهي، they grow out of it زي ما بنقول، فبس هو المعاناة هتبقى في أول فترة. البريكوشنز أو الاحتياطات إنه حضرتك لما تأكلي البيبي أو تأكلي بنتك تحطيها almost بزاوية تقريبا بالشكل ده، يعني almost أقرب للزاوية 90 درجة وهي بتاكل. الحاجة التانية إن احنا نأكلها بكميات أقل على وفترات يعني كمية نفسها تقل، ونأكلها مرات أكتر في اليوم. ممكن حضرتك لو تعملي انفستيجيشنز أكتر عشان نشوف المشكلة دي جاية من فين، لأنه حضرتك ما بعتليش الانفستيجيشن، فبليز مدام إزيس ابعتيلي الانفستيجيشن وهنقدر نوجه حضرتك من هنا. We have another phone call from North Carolina. سامح معانا من North Carolina، اتفضل حضرتك على الهواء.
ايوه صباح الخير.
صباح النور، اتفضل.
انا عندي سؤال للدكتور حضرتك. انا من شهر ابريل اللي فات كنت برجع كل يوم الصبح، اصحى من النوم على ترجيع يوميا باستمرار.
اوكي.
لما رحت الامرجنسي روم رحت مرتين، كانوا بيدوني حاجات مضادات للترجيع ويمشوني، ما عملوليش اي حاجه. اخيرا البرايمري كير بتاعي قال لي اعمل تحليل جرثومه الاتش بايلوري. عملت تحليل اتش بايلوري طلع بوزيتيف، اخذت نوعين مضاد حيوي.
تمام.
وارتحت شويه، بعدين رجع لي موضوع الترجيع تاني. عدت التحليل بتاع الاتش بايلوري طلع نيجاتيف.
اوكي.
رحت بعد كده الامرجنسي روم مره تاني، عملوا لي كات سكان، قالوا لي كل حاجه عندك نورمال. برضه من شهر لشهر عمال الموضوع يزيد.
فقدت كميه من وزنك او حاجه؟ فقدت وزن؟
فقدت حوالي 30 باوند.
30 باوند. اوكي. ايه اخبار الاسترس ايه في الحياه بتاعتك؟ كلنا عندنا ستريس طبعا، بس زايد شويه؟
عندي ستريس جامد جدا، وغيرت شغلي، وفعلا عندي ستريس شديد قوي.
اوكي.
في حاجات كتير.
سنك قد ايه معلش سامح؟
سني؟
سنة حضرتك؟
سني 41 سنة.
Okay. He's 41 years old, male, and he has recurrent vomiting, went to the ER, they give him antiemetic medication, it didn't control it, lost over 30 pounds, went to the primary care, did the H. pylori, was positive, took kind of antibiotics, got take care of it because the result later on came back negative. He's still vomiting till now, and he lost over 30 pounds, very stressed, work circumstances not as well.
Very unusual.
If you want to ask him any question, he's still.
Yeah, very unusual situation. With that kind of weight loss, of course, we would take it a lot more serious. Sounds like he had
he did a CAT scan in the emergency room and it came negative.
So, and he mentioned the stress. So that's very important to pursue, making sure that that's not a key contributor here. In some people, they have this cyclic vomiting syndrome, and this is a phenomenon that's recognized now. They appear to have no underlying disease, so the endoscopy, the CAT scan, the blood work, there's nothing going on, maybe some stress, mood disorder going on, but this is now widely, this is a relatively newly recognized syndrome, cyclic vomiting syndrome, and these people very often lose weight, and certain medications have been tried. They have some varying degrees, but some success. The tricyclic antidepressants have been big. I'm sure he's already tried multiple anti-nausea medicines.
Yes.
I think working closely with a specialist like the GI gastroenterologist is going to be very important here.
Okay. الحقيقة سامح لو سمعنا زي ما دكتور كيم قال في سيندروم اسمها سايكليك فوميتنج سيندروم، ان الناس بتبتدي ترجع بشكل متكرر او بشكل كبير جدا، بتفقد كميه كبيره من وزنها. حقيقه في نجاح كبير جدا لكلاس من الميديكيشن اسمه ترايسايكليك انتي ديبريسنت. فلو يعني محتاجين كمان نسال يعني اسئله بشكل اكبر، معلش لو تسيب حضرتك رقمك في الكنترول روم هنكلمك بعد الحلقه، لانه محتاجين نسال شويه اسئله. seems like انه انت النوع ده سايكليك فوميتنج سيندروم، وكمان الاسترس بيبقى سبب فيها. هنقول لحضرتك على نوع من العلاج، ولكن سيب رقمك في الكنترول روم معانا عشان ده نكلم حضرتك. So Dr. Kim, back to I have another question here. He's asking what kind of medication. We'll just talk about it now. What kind of medication can worsen the GERD in general?
So that's a very helpful slide. It's important for people to know that certain medications, they may be a key contributor or cause of the sphincter to relax, and maybe other mechanisms for this heartburn. It does not mean that these medicines, if you're on it, they caused it, but you have to consider that. So look at the timing, look at the dose. Ironically, you look on the list on the left there, tricyclic antidepressants. That is a medicine that can help reduce the body's sensitivity to various different kinds of pain. So for the dyspepsia patient, for maybe some of the heartburn patient, it's a medicine that can help you have less pain. So you have to weigh carefully, but it's important to keep these in mind. The calcium channel blockers, that's a type of a blood pressure pill. And then on the other side, we've mentioned the aspirin family once again that can irritate and cause ulcers. Tetracycline, class of antibiotics that can really cause some upset stomach. You can have easy sunburn, and a lot of people vomit with that class of antibiotics. Quinidine is rarely ever used in the United States. And then bisphosphonates, that's the osteoporosis treatment medicine, and they are very clear. You take that pill, you have to be upright. It has to be taken on an empty stomach, and you have to be upright for at least an hour, because when that comes back up, it could do quite a damage and it could hurt a lot.
الحقيقه سؤالي لدكتور كيم عشان احيانا بعض البيشنتس بياخدوا بعض الادويه بتخلي مشكله ارتجاع الحمض اسوأ بكتير من الاول، وقد احيانا تؤدي لقرح كمان. الحقيقه قال لي وعايز حضراتكم تركزوا في النقط دي معايا، لانه الادويه دي فعلا بتسبب مشاكل كبيره جدا. اهمهم على الاطلاق الاسبرين، عمال على بطال بيعمل مشاكل، بيعمل قرح، قد يكون سبب من اسباب ارتجاع الحمض. الناس اللي على النون ستيرويدال انتي انفلاماتوري دراجز اللي هي بتاخدها عشان البين، اللي بتاخد الدراجز دي عماله على بطال عشان الصداع، مشاكل مش عارف فين، ده بيعمل اللي هو كل البروفين او الايبوبروفين بشكل عام بيعمل مشاكل كبيره جدا. بعض المضادات الحيويه زي التتراسايكلين بتعمل مشاكل كمان في المعده، فممكن احيانا ناس تاخد مضادات حيويه بالذات مثلا لحب الشباب ويعمل لها قرح في المعده بشكل كبير. فالبنات والسيدات اللي بيهتموا جدا بفكره حبوب الشباب وبتقعد على مضاد حيوي لفتره طويله عليها قد يسبب مشاكل في المعده بشكل كبير جدا. كمان السيدات اللي بيعانوا من هشاشه عظام وبياخدوا دواء معروف جدا اسمه بيسفوسفونيت. البيسفوسفونيت ده بشكل عام او ادويه هشاشه العظام اللي حضرتك بتاخديها، وبعدين لازم تقعدي تقريبا من نص ساعه لساعه قاعده بشكل يعني قائم، وبينصح انه تاخدي كوبايه لبن معاها. خلي بال حضرتك انه احيانا الادويه دي بتعمل كمان ارتجاع وبتعمل ألسر، احيانا بتعمل كمان قرح معده. فبننصح كل السيدات اللي بياخدوا ادويه لهشاشه العظام انه حضرتك بعد ما تاخدي الدواء تفضلي تتمشي من حوالي نص ساعه لساعه او تقعدي بشكل قائم زي ما احنا قلنا، وكمان لو تاخدي معاه كوبايه لبن هيبقى افضل بكتير. عايز اقول كمان انه من الادويه اللي بتعمل مشاكل احيانا ادويه الازمه بتعمل مشاكل، ونخلي بالنا من الحكايات دي او من النوع ده من الادويه، لانه زي ما انا قلت الخمس ست انواع دول من الادويه بيعملوا مشاكل. هقولهم تاني: الاسبرين، مضادات الالم، بعض المضادات الحيويه بالذات بتوع حب الشباب، السيدات اللي على ادويه لهشاشه عظام اللي بتاخده كل اسبوع او كل اسبوعين او احيانا كل 4 أسابيع، كمان ادويه الازمه بتسبب نوع من مشاكل ارتجاع الحمض بشكل كبير جدا. So we talked about the symptoms, presentations and everything. How would we diagnose? How we get a definite diagnosis?
That's right. So for GERD, for many people who don't have serious features, the alarm features, it is acceptable to diagnose it just based on a good story. You do not have to get an endoscopy. You do not have to have some radiology, some swallow, barium swallow. But the older you are, especially above age 60, the more there are risk factors, prior known problems, atypical features, and then the alarm features. You have recurrent vomiting, you vomited blood, you have food that are stuck, it just does not go down easily, or you have pain as you swallow, or if you have evidence of blood in your bowel movement, the black, tarry, melena stool, or some other risk factors. Asians, they are known to have more gastric cancer. Certain other places, Africa, Caribbean, maybe certain Latin American countries, especially Chile. If you've lived there for a long time, especially into adulthood, you have a little extra risk factor for gastric cancer. So all these alarm features or risk factors, these we recommend receive an endoscopy in United States and Western medicine.
Okay. And if not that, can we do like the 24 hours pH studies and all?
So this is very important to emphasize. The 24-hour pH study is they put multiple probes and they put this, it's like a line in your esophagus, and this thing accurately tells how high the acid kept coming up 24 hours. So it'll look at the sleep pattern, the daytime pattern. This study is to be rarely ever considered. It's very important we emphasize this because, as we said earlier, everyone has acid reflux. So we know we're going to find a certain amount of acid reflux in healthy, normal, no symptom people. And also we find that the acid reflux does not match the amount of symptoms. So a lot of people have more reflux, not that much pain. Then there's people with very little reflux. They have a lot of pain. They're very sensitive, hypersensitive. So this study is very, very limited, and it really is in a university setting is the way we think of it. So very unusual, very complicated. There would be something very, very difficult or unusual that would lead to that decision, and it's usually referred beyond a community setting to a university GI lab.
So what about the manometry, the esophageal manometry?
So the manometry is the one that measures the pressure of the esophageal sphincter. That may be considered, especially if we get to the level of thinking about the surgery to help kind of tighten that esophageal sphincter. I don't think it's always done, but I'm not sure about that. That's also a relatively rare study.
So we should start usually with the H. pylori, as simple as this.
The H. pylori, remember, is not for heartburn. It's very important people don't mix the two. It's for the upset stomach, the dyspepsia, acid indigestion, that crowd. For heartburn, almost always there's really no thought about the H. pylori bacteria. So H. pylori is not thought of, but at the endoscopy, do they have... It's not responding. There was a woman with the omeprazole and the famotidine Pepcid, and it's not responding. You know, she may be a healthy and under age 60 person, but most of the time they would do an endoscopy to take a look. She said she already knew she had hiatal hernia, but that would be an example.
Okay. I have another question here on Facebook. He's asking, his dad doesn't digest any kind of fruits. At the same time, he's suffering from severe GERD. So he's asking, what would be your recommendation?
So fruits are very upsetting to his stomach.
And he doesn't digest it at all. It goes like as is.
That's interesting. And then he also has heartburn.
Right, severe heartburn.
That's interesting. You know, with many people with what we would call functional dyspepsia, that means all the workup shows no real structural disease, negative endoscopy, or essentially normal endoscopy, and yet they have a lot of stomach or even entire abdominal symptoms. A lot of those people, we do know that a lot of fruits, certain vegetables, a lot of fruits, they can really cause a very irritated, upset stomach, and they could have diarrhea or just altered bowel movements.
So if we take care of the GERD, it might help.
Well, I was just going to say, so it's not that surprising that certain foods like fruits can really upset their stomach and kind of make them have the runs and a diarrhea. And it's well recognized. It's good to know that. And I would catalog the bad foods and really avoid them. That is the recommendation. I think a lot of them tend to have more heartburn than the regular population. So that would also be treated the way we talked about here. I think the PPI medicine, the head of bed elevation when they sleep at night, smaller amounts of food, and avoiding some irritating foods. Those are very important to be doing.
سؤال مينا بيسأل إنه والده ما بيهضمش أي نوع من أنواع الفواكه، بيعاني كمان من الحموضة. زي ما قال دكتور كام، نحاول نعرف أحيانا في ناس ما بتهضمش أنواع معينة من الفواكه، فنحاول نعرفهم ونتجنبهم. بالنسبة للحموضة ممكن حضرتك تجرب أدوية الحموضة اللي احنا ذكرناها في البداية، ولو تقدر تبعت لنا تفاصيل أكتر يا مينا هنقدر نساعد ونفهم إيه طبيعة المشكلة أكتر. الحقيقة سؤالي الأخير لدكتور كام كان عن إزاي نقدر نشخص أنواع ارتجاع المريء، فقال لي بنبتدي بحاجة بسيطة جدا اللي هو تيست الاتش بايلوري اللي هو بيسموه التنفس، وبعدين إذا المشكلة ادينا أدوية واستمرت بنبتدي نعمل بعض الانفستيجيشن عشان نشوف حركة البلعوم أو المريء. كمان إذا في أي حاجة من الأربعة الساينز المقلقين اللي هو فقدان وزن بدون سبب، أو في أي نوع من أنواع الأنيميا، أو زي ما احنا قلنا لون البراز بيتغير إنه يبقى لون أسود تماما، أو كل السيمتومز دي تحت الادويه مش عامله كنترول، بنعمل منظار لانه ده مهم جدا ان احنا نعمله. الحقيقه اسئله كتير جدا جايه على الفيسبوك، انا بعتذر ان احنا ما قدرناش نجاوبها كلها، خدنا تليفونات قد ما قدرنا، جاوبنا اسئله قد ما قدرنا، ولكن انا هرجع لكل الاسئله دي ونجاوبها لحضراتكم. بعتذر ان احنا ما قدرناش نجاوبها كلها، كمان ما خلصناش موضوعنا ولا طرق العلاج، فهنخلصه في حلقه تانية ان شاء الله. بشكر تفاعلكم جدا، بشكر السبورت بتاعكم الوايت كوت. Thank you so much, Dr. Kim. It was very informative.
Thank you, Tamer.
And we'll finish this up in the next episode.
That's right.
Thank you so much for your support. بشكر حضراتكم على التفاعل، ونشوفكم في حلقة جديدة من وايت كوت الأسبوع الجاي على خير إن شاء الله.